People are starting to join. Good afternoon, everyone. I'm going to give everybody a few minutes just to get logged in here. We've got quite a few joining us. We're up to 52.
Oh, that's excellent.
All right, I'm going to get started, and those that are joining can just join in. My name is Karin Mayfield. I'm the Executive Director of the West Florida Chapter, and I want to welcome everyone to our webinar today. And with that being said, I'm going to turn it over to our moderator, Alan Tannenbaum with Tannenbaum Scrow.
Hi, everybody. I hope you're faring okay. I'm Alan Tannenbaum. I'm a construction lawyer. I've been asked to head this panel today as a moderator. And before I introduce the panel, what this session is about is the push and pull that we're all experiencing now, with seemingly half of society becoming totally laissez-faire relative to COVID protocols, and the other half maybe even making their protocols more stringent because of the other half that's become totally laissez-faire. And what we've done is we've brought a group of industry specialists in various sectors of the community association field to talk about their experience relative to this push and pull that's going on out there that I'm sure you all have experienced also. And I want to relate a couple of things that happened to me recently. There was a condo manager in St. Pete who actually had the COVID. She came back to work. She was on-site manager, and she established protocols in her office, very strict. She had her mask on all the time. Everybody had their mask on. And I went there for a site inspection. She was very careful. She kept her distancing. Then they had a board meeting. So the board meeting was supposed to be a video conference, but certain of the board members wanted to attend live. So all of a sudden, the boardroom where she was broadcasting from was filled with a few board members, but none of the people on the video could hear any of the board members talk. So what did they do? They came up, they sat in her seat. They touched the space right in front of them. And the look of exasperation on her face was really evident, because she had this protocol for at least 3 weeks that they totally blew out of the water. And then I was invited the other day. Well, I had a meeting with a client at Apollo Beach. I said, let's do it by video conference. They didn't want to do it. I said, we want to meet live. I said, I'll go to your property. You're not going to come here to my office. They said, fine. I said, where are we going to meet? They wanted to do it in the unit. I said, I'm not comfortable with that. Let's do it at the pool. They were non-believers. They were like, this virus is ridiculous. And every time we walked the site, every time we were walking the site, the president kept moving into my space, and I kept, everybody calls it the COVID dance, when somebody, wants to get in your space to be friendly and you're like pulling back. So that's my experience. But let me introduce the panel, because they all have their own stories to tell. So David Daly, you're going to hear from first. He's a PCAM and an individual manager at a condo in downtown Sarasota. Diane Alfano is on the board of a condominium association, so she's here representing the board members and their experience. Cindi Bass is a representative of Florida Southern Roofing and Sheet Metal. And she's going to talk about the peculiar experiences some of the workers in the company have had in interacting with the public out there in the field, and what they're trying to do to mitigate their own safety concerns and the client's safety concerns. We have Wayne Applebee, who is a senior manager for the Sarasota County Health and Human Services Department. And what Wayne is going to talk about is that the government's experience in interfacing with the public, misconceptions the public has about, what the government's role is, what the government's authority is, what it means when the government opens something up. And he's got some very interesting things to talk about relative to the sheriff's department, being called in to kind of be the referee with people who want a distance and people who don't, and what their role is. Tommy Kochis is with Atlas Insurance. He's going to talk about some of the calls that he's been getting, where he's been, asked to referee on, are we covered? Are we not covered? What can we do? And then, of course, Curtis Hamlin is the general counsel that everyone is quite familiar with. His clients have been experiencing all these things. And Curtis, when he goes on, is also going to update us on the latest orders put out by the government, what it means for community association operation. So with that in mind, and you can ask questions as we go along, and we'll see them all in our chat room box, and we hopefully will be able to get to all of them. All right, so David, you're a manager of a downtown condominium.
Yes,
I haven't disclosed the name of it. That's up to you. It really doesn't matter.
Well,
And my general question for you is, what kind of push and pull have you faced relative to COVID protocols, and between your board, between the owners, between guests? Tell us your experience.
well, actually, it's a great day to have this meeting because we had a board meeting last night, and I have to say I'm lucky enough to have a wonderful board and a wonderful president. And he and I have been working on phases of reopening the amenities. We have a swimming pool, a fitness center, a gathering room, a media room, and a guest suite. The only thing that's been available has been the swimming pool on a very reduced occupancy. We've put 4 tables out there and 10 chairs for people to move around as they see fit. And we've strongly encouraged everybody to follow CDC guidelines regarding social distancing. We've also made it clear that there is no cleaning going on, because you can't possibly keep up with somebody going to swim this morning and then leaving at 11 and someone else going at 11:30 and then somebody else at 1. So we can't clean the area after one person has been swimming. So that's been left to them. It's been made clear that it's been left to them.
Are the owners happy with that?
Yeah, there's been no complaints.
Okay.
There's been absolutely no complaints. We've sort of given them a few hints. We have been told that one of the best things to do, and this is open to interpretation, is to get a little cloth or something and even use pool water to wipe them down with them. It's not as strong as a wipe, but it does have chlorine in, it's at a safe level, and it was better than doing nothing. So that's been working out very well. We've been doing that for about 3 weeks. The biggest request we've had as a result of the governor's announcement on Monday is to open the fitness center. And the general feeling was that that's probably going to rile a few folks up with this. It's probably the most dangerous place to open, just by virtue of what you do when you're in there. I mean, the idea is you go in, you sweat, you breathe heavy, and the COVID virus is airborne. And it can get to you through air and through your eyes and through breathing it. Well, if you're working out hard, then it's all over the place. So it's a very dangerous situation in my mind.
So what is the board going to do?
Well, the board's not going to open it at the moment. What we're trying to do is we can redirect the AC system. At the moment, it's a recirculating AC system. So the air just gets turned around over and over again. We have made inquiries and we're in the process of trying to redesign the airflow so that, to back up a little bit, the fitness center is actually in the center of a hallway of 3 hallways. And that air in there is conditioned, it's inside hallway. So we're going to pull conditioned air from the hallway, put it through the AC unit, and then expel it outside. So it will no longer be recirculating air, it will be fresh air in and the used air out. So it should help.
Are there board members who are saying that even with that, they're not comfortable with opening it up?
Correct.
Okay, so how do you deal with you know, having a board where some people say open up and some people don't?
Actually, when we initially started, it was a 4-1. 4 were against opening, 1 was for opening it. And by the time we finished, it was a 5. None of them want to open it until we've done a minimum of deal with the air conditioning. We're then thinking it will be 1 person at a time. It will be a sign-in sheet, a maximum of an hour, and there'll be 10 to 15 minutes between each user to allow proper cleaning by the users. Again, the association will not be doing that. One of the biggest things that came out, and it was interesting for Alan and Kochis, was one gentleman turned around and said, the more you do, the more responsibility as an association you are taking for people's safety. And is it the association's business to keep everybody safe? We should be doing what we can to keep the building safe. We've increased our cleaning, we've increased disinfectant, all the high touch areas. We've put signs up to wear masks. We've got traffic control arrows in the front lobby. We're encouraging people strongly to wear masks, particularly in the elevator. But do you go beyond that?
Well, right. you say encouraging.
Oh yes, encourage. You can't make anybody do anything.
Well, I mean, when somebody comes in without a mask, do you have the person at the front, the concierge? How aggressive are they with their recommendation?
It's quite interesting to watch, because if it's a vendor, it's a very positive. You need to wear a mask. You need to sanitize your hands and wear a mask before you move into the building. If it's an owner, it can be slightly tongue-in-cheek. You know, hey Wayne, where's your mask? And you either get, oh, it's in my pocket, and they put it on, or they just walk by you. So, and that's as far as we go.
All right. You know, what about construction? I mean, have there been owners who want to do complete a renovation project, and have those vendors been allowed in?
No new projects have been authorized since this started. Anything that was in process is allowed to finish, and so there is no new construction.
Well, are there owners who want to start new construction and they're not happy with your policy?
So far, we haven't been challenged too hard.
Okay.
I think everybody understands. I think, again, we're lucky. We've got good owners and they understand what we're trying to do.
All right. Well, let's move to Diane. So Diane, I know you have a very copacetic group of owners, and everything's going really well, or maybe not.
If only.
Right. So what kind of excitement relative to this push and pull have you experienced? And you're in an HOA, correct?
No, it's a condo.
Okay.
Yeah.
All right. And so what kind of experience have you had?
This has been my most difficult time being on the board, because you know, we're just not sure if we're doing the right thing with all of the restrictions that we're doing, but the community is very divided. We have some people, the day we closed the pool, there was one of the owners in the bushes with a camera taking pictures of all of the people who were not social distancing at the pool. So I don't know what she was going to do with the photos, but she was taking the pictures. And on the other hand, we have very outspoken people who don't believe that that we are making decisions based on logic. He accuses me of making decisions out of fear, and he started a petition to remove me from the board. So, oh, wow. You know, we've got two extremes, and it's hard for me to take a walk around the community without being stopped 5 times by people who tell me they're going to sell and they're going to move. And all because the only amenity we have is a pool, and it's closed. We are thinking about opening it on Friday. We have a board meeting tomorrow. If we open, all of the furniture has been removed. You have to bring your own chair so that we don't have anything we have to clean. We are closing the bathrooms. You have to use your bathroom at home so that we don't have to worry about cleaning bathrooms during the day. And we are limiting it to 15 people in the area, and you have to social distance. If they don't, we're going to close the pool again. And that's, you know, we've made that very clear to the community. And we also told them, you're coming at your own risk. If you are not comfortable with it, don't come to the pool. It's that simple. And, you know, our biggest issue is going to be enforcement, because none of the board members want to be the people who have to go face to face and confront somebody who's not social distancing.
Well,
Unfortunately-
Wayne's going to send some sheriffs to do that. So. Talk about that
Thank
later.
you. Thank you, Wayne. That will help a lot.
He's going to give you his cell phone number so you can call him direct.
That's right.
I already have his email, so.
Diane, let me ask you this.
Yes.
All right, with the board making these decisions, open the pool, don't open the pool, who are you looking to for guidance on that? Or what are you looking to for guidance on that?
Well, we're following what the county does, and we're watching them. CDC, of course, is, you know, for how we're handling things. We talked to our property manager and property management company. They were very against opening the pool. So, you know, that didn't help. And then we talked to our insurance agent, who told us that we may not have any insurance coverage if there is a lawsuit that comes out of opening the pool. If someone claims that they've had, that they've contracted the disease while in the pool, then, and sues us, you know, we may not be covered, and it may have to be the owners who pay a judgment if it should come to that. Now, a lot of the homeowners will tell me that you can't prove that you got it there. And my assumption is that if you go to court and you file a lawsuit and you get a sympathetic jury and they listen to your sad story and they say, oh, that big bad association has caused all these problems for you, well, you know, they may rule against you. There's no guarantee here that you're not going to be on the line for something.
All right, so there's definitely liability concerns. And I want to tell the audience that we see your questions, and what we're going to do near the end, especially during Curtis's time at the end, is he's going to take on with the other panel members some of these general questions. I see there's a question about the short-term rentals, and we'll take that on in let's say the last half hour when we have Curtis get on. So be patient. All right, well, let's move from Diane over to Cindi. So Cindi, your company's, did we lose Cindi?
I think she ran away.
Okay, well, let's
Yeah, I don't see her on the screen.
yeah, Cindy's going to have to get back on. So when she gets back on, we'll start again with her. So Wayne, let's talk about the government's role. And what Wayne has been good enough to do is, you know, he can talk about what his position is with the county, but I think he's also had conversations with other representatives of the county. And what we're interested in is, based upon the contacts the various agencies have gotten, what are the public misconceptions about county authority, about when the county issues a mandate or removes a mandate, and you know, how is the county involved both in protecting the health and safety, but also in enforcement?
Sure. So thank you very much for having me. You know, the role of government that's a loaded question, especially in these times. We have different levels of government with different levels of responsibilities. And, you know, there's also politics obviously plays into the directions and actions that elected officials give to their staff to respond. So, you know, since we live in a democracy and not a dictatorship, you know, there isn't one leader in the nation, you know, placing martial law on all of us. And so personal choices often become, you know, the responsibility of individuals because, you know, much like we have a speeding law, there isn't unlimited resources to stop every speeder that speeds every day, 24 hours a day. So yes, we have a law, we have public campaigns, education to try to inform the public as to what the laws are and the reason behind those. So clearly in this environment, you know, we struggle with the same types of things, providing factual information that's going to protect the community, and you know, passing orders and different rules and regulations that help support the health and well-being of all citizens can certainly be put in place. And even if a government has the legal authority, doesn't mean that they always, it's always best to employ it in a black and white sense. And I'll just use this analogy. If a community faces a protest and people are hurling bottles at the police, then you're probably not managing the community real well, balancing, what the beliefs and the morals of the community are. And since we are a democracy, we try to find that balance. So just because we have the authority to charge somebody, say, with a misdemeanor against the governor's order, doesn't mean that that's going to be the approach of law enforcement every time a citizen calls and may be upset that somebody isn't following it. So,
all right. Well, let me ask you some pointed questions. So, right now, is there anything mandated by Sarasota County government that governs how people have to operate out there in society? Is there anything mandated versus suggested?
Yeah, so again, I think clearly the Sarasota County has followed really the governor's orders and tried to align themselves with what the governor has done. And technically there is, a person can be charged with a misdemeanor for violating those orders. But again, the orders related to this, are not down to the level of you must wear a mask, so that again is just a suggestion. People may be upset when you interact with somebody without a mask, but there's really nothing legally that an enforcement arm is going to take in Sarasota County against that. So
the county doesn't have any restrictions then that are more severe than the governor's order?
No, not currently. They do not. No.
Okay, and is there any, to your knowledge, is there any part of the governor's order? I know something like short-term rentals may be prohibited, but is there anything in normal society functioning that is actually prohibited by the governor's order that Sarasota County enforces? Or is it all based upon suggestion?
So essentially, things such as in the governor's phase one's opening, it does not allow people to visit their relatives, say, in a nursing home or ALF. So clearly that would become an issue if somebody violated that and a facility called the sheriff's office. I think that's an example of something where the sheriff's office would, in fact, take action, not only because of the governor's order specifically on that, but also because a person can be lawfully banned from a facility, by the property owner. So I think there are certain things at that level that there may be direct consequences for someone to violate it. But in the general sense of what we all do every day, the sheriff's office, what they did is they identified early on that they were going to probably receive complaints related to social distancing and people not following CDC guidelines. And so they established a dedicated team of officers to specifically respond to those types of complaints. In the last about 6 weeks or so since it was established, they've actually responded physically to 200 complaints in regard to that. But their mandate by the sheriff is a framework of educate and encourage and gain voluntary compliance. And they've really reported that really once they've arrived on scene, people really do, at least for the moment, heed the sheriff's suggestions and education and encouragement and go about their business. The sheriff also has partnered really well with the county. His helicopter provides regular flyovers of the beaches and alerts patrol deputies and our lifeguards if they're seeing kind of any issues of non-social distancing, so that education and encouragement can be made. Those daily reports are going to the county commission every day on every beach that we have. So there's a constant flow of data going back to the commission on how our community is generally doing in that regard. You're always going to have anomalies. You're always going to have people who will not follow rules. But in a general sense, our commission's been very pleased, and our sheriff's been very pleased with the way the citizens have responded to the recommendations.
Now, let's say a community association, they're trying to enforce their own distancing regulations, and somebody's not cooperating. Let's say somebody wants to use their internal gym and it's just saying, I don't care, you have a restriction, I'm going to work out, and you're
Right.
called, or the sheriff is called. To what extent does the sheriff get involved in kind of mediating or enforcing, restrictions for, like in a community association?
Yeah, well, I think if that situation happened in a community association, at least here in Sarasota County, a representative of that dedicated unit would respond at your request, would come in and evaluate the situation, at a minimum, provide that education and encouragement. At the most severe end, obviously, if the sheriff is comfortable that, the gym is controlled by another legal entity, not this particular person that's trying to enter it, certainly, I think would provide a lot of support to the association to say, this area is closed right now. It's not an area that you're allowed to be in, and I'm going to give you a lawful order to not be here, So, obviously, there could be complexities to that in each and every organization and facility, to where the sheriff might feel that there's more of a civil issue going on here than a criminal issue, and then maybe would not provide such a direct, removal of an individual.
All right, now you're with the health department. I know that's not what it's titled, but I'll call it that.
Right.
What kind of requests have you gotten, or your department's gotten,
Sure.
that might reflect on a misconception by the public of what your role is?
Sure. So in Sarasota County, we're a little bit unique in that the county has the typical responsibility for human services, social service type activities, and the health department is a state department of health, a state agency. But in Sarasota County, we are combined organizations. So I have state employees that work for me, and I have county employees that work for me, and I work for a state employee, even though I'm a county employee, but we're all under one umbrella of health and human services. And so, on really the health department side, their primary responsibility at this point as a local health department for Sarasota County, even though they're a state agency, is the testing, surveillance, and contract tracing of individuals who have COVID. So testing has been a huge part of the emphasis, of course, and early on, testing kits and testing availability for diagnostic tests were hard to come by, but now they're readily available. There's multiple areas, even asymptomatic people can be tested. We've tested about 10,000 people, but folks now really, in the way to get a handle on this is to have really a rapid and regular presence of antibody testing, which is not currently available in the community. There's a lot of entrepreneurship going on across the world and the United States with tests, but their reliability is very questionable at this point, not having gone through the FDA. You can go to the FDA website and find antibody tests that have been vetted by the FDA. We would encourage people to work through their primary care physician for that particular thing. So really, it's really getting a handle on who's currently has the virus in our community and how can we contain it within our community once we know folks have the virus. But that doesn't mean, even though that this pandemic has taking an enormous amount of resources, the health department still has its obligation every day to worry about water quality and beach quality and other immunizations and other communicable diseases and the things that they do on an everyday basis. On the human services side, you talk about misperceptions. Early on, there was a lot of panic about homeless individuals as being folks who were vulnerable and carriers of it. And it really was, it was a perception that was out there, and there was a lot of demand for an immediate response. But the reality is that really wasn't initially the population that was being affected in our community. It was folks who had the means to travel, folks who socialize on a regular basis. Homeless people tend to be more self-isolating. They tend to have more resiliency because they do live on the street. They don't tend to gather in social events and crowds, and they don't tend to interact with people who travel a lot. So that isn't really where our initial reaction or focus was, because we had limited resources. We focused it on the population that was getting the most affected and dying in our community. But as the testing sites have, testing availabilities become more available, we have recently made that a priority to just check that population from a testing perspective. And it's interesting, we went out to pre-register them, and their perception is that they believe they're almost immune from it because they're so resilient and they deal with everything on the street and they're feeling fine and there's nothing that they're worried about. Unfortunately, we still tested about 20% of the unsheltered homeless in downtown Sarasota. But again, the average citizen felt, that this was an at-risk population, and really the most at risk they became is when folks with means would come by and deliver food to them. They were more likely to be the carrier because they were the ones who had been traveling or in social gatherings, and they were more likely to be the carrier into the population. Fortunately, since the virus has started, we've only had 2 homeless individuals tested positive, so it's not been a spread in that community. One had other medical issues and stayed in the hospital during the entire time that they needed to be quarantined. The other we placed in isolation in a hotel room.
Wayne, how have you? What have been the issues as far as protecting county employees?
Yes.
When they go out on calls and
Yeah.
and are confronting situations, how do they protect themselves?
Yeah, so that's obviously always been a struggle as well. As government employees, we're very accustomed to having a disaster or emergency response, right? We all have our regular job, but we have an emergency duty assignment that may be separate and unrelated to what we do every day. And so, this pandemic is the same for us. So we all have assignments related to that. And are, as part of what you sign up for when you become a government employee, is to respond when the community needs you. So first and foremost, of course, is providing information to the employees on the ways they can protect themselves, as well as what we can do from an environmental standpoint as an employer to help them be safe. So like everybody else, if they have a position that can be done from home, they work from home. But we have a lot of positions that you can't do that. I think of our SCAT bus drivers, our fire EMS, lifeguards, health and human services, people, fixing utilities and public works and code enforcement complaints. So that work still goes on. So first and foremost, we advise them to the typical stuff you all heard by now, I'm sure. Maintain distance first, because if you can maintain the distance, the risk goes extremely low. Second, wear the appropriate PPE, regularly wash your hands, increase cleaning in your facilities or your workspace areas, whatever they may be. And at the slightest indication that you're not feeling well, we want you to stay home. So that's kind of, been the message to the community, and to the staff. And we've also, because we have different assignments and not all of them require to be, a public facing activity, especially with some of our emergency disaster roles, like trying to get reimbursements from FEMA and paperwork and other kinds of things. Our HR department did an evaluation of all of our employees age 65 or older or having one of those medical conditions that were at risk, and provided them an opportunity to work in a different environment. And if they chose to continue, make sure they had the safety features in place to protect themselves. And there was a general sense that employees could make the county HR department aware if they were just ever uncomfortable in an assignment that they were given and didn't feel that they were were having what they need to protect themselves.
Well, my last question to you, I mean, have there been any instances, for instance, the sheriff's called out on a domestic dispute and, you know, they got to break it up.
Right.
And, you know, I don't know, are they wearing masks at a point like that? Are they wearing gloves? How do you break up a fight without compromising yourself?
Yeah. So sheriff's office staff, like all our others, they do have a level of PPE protection that's been assigned to every deputy. You know, the question is it always the ability to use it in every given, especially emergency situation that you have? So yes, I believe when the sheriff's deputies go out, yes, they're required to use, I think, a mask and gloves, you know, when they respond. But, you know, if fortunately, a lot of cases get resolved without being physically hands-on, but clearly there are going to be those times where they need to, you know, be in a close proximity and be physical. And there is some level of risk in that, and it can't be avoided 100% of the time. Most law enforcement agencies have also gone to a stance of if they can handle a complaint via a phone calls, then they do that. They've also been encouraged to do less self-initiated. You know, police act in a function of responding to calls, but also sometimes self-initiated activity. And so they're monitoring.
With impunity.
Right. So in other words,
so
right. I'm kind of I've lost your voice a little bit, so I don't know exactly what you said, but I think I got the gist in that. And that, yes, I think they are making decisions, and it's at each law enforcement agency, so it's not uniformly making a decision about, you know, at what level is it worth the risk to place their staff in danger, you know, versus that's not something we're going to self-initiate an enforcement action on today. So.
Okay. Thanks for your input. So Cindi, we're going back to you because you started and you disappeared from us. So
sorry, I have my ACA technology. So sorry. Hopefully you can all hear me now.
so tell us about the kind of the excitement that your workers have experienced trying to go out to projects to do their job, and what type of situations have they run into that may have made their job a little more difficult?
I really haven't heard too much. I've been working from home for 3 months. I've been back to the office twice. However, I did get an email from one of my property managers right in the beginning, and it was like, uh-oh, one of our team members went into a home without a mask on, and the homeowner invited them in. So she's like, I just want you to be aware. So we have changed up or even gotten stronger on the protocol. Pretty much what Wayne says, we can give them all of the techniques and things that they can use, just hopefully they use them. I talked to our safety coordinator. We have an on-site safety guy that normally he handles OSHA, and well, now we've added this COVID-19. So he is proficient in COVID-19, and he goes to each job site to make sure that our team are doing the right things. And one thing he did tell me is the portalettes that we have for these large jobs have hand sanitizer in all of them, which I think is a great thing. Now, our team members out there that are on the roof, they won't come in contact with board members or homeowners. They're on the roof doing their thing, but it's mostly our sales team, our service crews, and I haven't heard of anything disruptive that they have gone through. So what we do is we get I'm sorry?
Sometimes don't they have to go up the elevator to get to the roof? Sometimes.
That's a possibility, and I'll be honest with you, I haven't heard any stories of that.
Okay.
I haven't heard anything about that.
All right, so you do business development for your company.
Yes.
And what you said is that you've been home for 3 months.
Yes.
So,
busier than ever.
Yeah, but how is it to be a business director for a company and basically be isolating at home? How have you altered your ways in order to keep your company in business, getting new jobs and so forth?
Learning Zoom. I'm pretty good in Zoom, but keeping in contact, I'm a face-to-face person. So many of you know me that we have a lot of events. We do CAI breakfast. I'm on the board. We go here, we go there. Can't do any of that now. So I had to find an alternative way. Zoom, GoToMeetings, Teams, Microsoft Teams. We've done a lot of staff meetings on Teams. We do a lot of webinars. So it's been difficult. However, I've been trying to keep in touch with my customers and trying to get our business out in other ways. So writing handwritten letters and note cards and making a phone call and working on our website and doing webinars and things like that. So it's been tasking because it's not my forte, but it's become efficient and it's working.
Have your salespeople confronted a situation where a group says, we know we need a new roof. In fact, we may have active leaks, but we really don't want to do a project like that until the COVID situation is resolved. What kind of things have your salespeople been responding to when they get a response like that from a group?
We've actually had a couple of those because we've reached out to a lot of people, and only a handful have said, no, we want to hold off for now. But I think more of it was maybe the economy. Maybe it was other board members unsure, but they said they didn't want to cancel it. They just want to postpone it. And then we've also had situations where we go out to a clubhouse and we had a meeting. Everyone was social distancing and we did the meeting and they're continuing with the job. I had another one with a webinar. I will be picking that contract up tomorrow, but all of the board members and our team sat on a webinar and discussed everything. So like David said earlier, it's some are this way and some are this way. So what we like to do is to put it up front. How do you want us to be? We will accommodate you. If you want to hold off, we will definitely hold off. But if you want to proceed, we're here. We have not stopped working yet.
All right, so you're on the board of CAI local chapter. So what's been some of the board discussion in CAI about when to have the first public event? And if we do have the first public event, what kind of protocol do we want to institute? And do we want to maybe have a public event, but also do it by Zoom for people who are not comfortable? What kind of discussions have you participated in, if any?
Well, I might defer this to Mr. President, Mr. David Daly. However, we are going to, I think, is it June 3rd? We're going to have meet the board. We're going to have a discussion about the board. And that's exactly what we're going to talk about is what we've discussed, what the future holds. Hi, Karin.
Hi. Yeah, we're going to have what's called a brunch with the board because we haven't been able to have our breakfasts, and our members love our breakfasts. They love to get together and network. We thought it's not going to be a webinar. It's going to be a Zoom meeting so that we can see everybody and everybody can see everybody else. But the board is going to give anybody any member, it is for members only, any member who signs up, they're going to give a State of the Union, how we are, where we're looking to go, and our financial well-being and all of that sort of thing. I haven't really discussed it with the board. We did cancel the June breakfast, and we don't typically have any events in July. We're hopeful that we can have an August breakfast. Hopeful. We don't know yet, and we also have manager all day in August, and we're hopeful that we're going to be able to do that. And there might be some restrictions. There might be still some social distancing and things like that. So we'll have to work with the facilities to see what their restrictions are and discuss with the board where we think our members would be comfortable. We're not going to do anything until our membership is comfortable, till we feel that we're really going down in the number of cases. We're still going up. It's my understanding we're still going up with the number of people that are being diagnosed, and I think that's because of testing. But until we see it start to flatten and go down, we're not going to put anybody at risk. And I hope that answers your question.
Yeah, just so you know, there's another chapter that I'm involved in. They have their breakfast scheduled for the end of June, and they seem to be intend to go through it. And there are some private groups that are giving CEU presentations, and we were specifically asked probably 10 days into June to participate in one, and they publicize that, well, there'll be, it's in a really large room and there'll be spacing. And one of my questions was, well, are they going to space people as they walk into the room? Because otherwise you have these, 3 entrances and 5 people are walking through at once. And it's nice that then you divide the tables so they have spacing, but they've already blown the spacing by getting in or registering at the table when they're walking in. So it's funny how we handled it, because in my office, I'm definitely a protocol guy, and my partner Salvador Scro is more on the laissez-faire side. So Sal's going to give the presentation and not me. So that's how we decided within our group. Okay, so Tommy has been waiting very patiently from Atlas Insurance. Tommy, what are the kind of questions that you've been getting? Where do you see people are confused and looking to you for guidance, and what things can you give guidance on, what things not?
Yeah. So it's a great question. I think people are just looking for answers. I think they're looking for guidance on what to do and how to do it. And I'm getting questions from, can we use a waiver, which I see up there? Tell me how to open my pool and be safe. Can I be sued? Do I have liability? And as any good insurance agency, I kind of pass the buck along. Those are questions I can't answer. And I send them to the attorney or the professional management, because it's really something that the insurance companies aren't giving guidance on. What I can comment and I tell people on is, let's talk about how your policy will respond. Because a lot of them are concerned with the liability that goes along with it. And that's a question for the legal experts to decide whether an association has liability or not. But how are they going to be defended? Or is the insurance company going to provide protection in the event of a loss? So I've heard a lot of things out there where insurance agents are saying, no, you don't have coverage, or you may have coverage. And I guess the best answer that we're getting that I could give is, you really need to talk to your insurance agent and go over how the policy works, because there's policies out there that have certain exclusions, and there's policies that don't have the exclusions. So every case is going to be a little bit different. And even when we talk to the insurance companies and say, hey, are you going to cover this for COVID? They'll go, well, it depends. It depends on what the claim is. So I usually go through 2 things when I'm talking about COVID with associations and their boards. 2 triggers that'll probably come in. One is the directors and officers. And the directors are scared to death to make a decision, and rightfully so. They sit on the board. They don't get paid to do this volunteer work, and they're trying to make the best decision for their association. So they want to know that if they're personally brought into a suit, are they going to be covered? Well, the D&O does provide protection for board members for the decisions they make, for a breach of duty or breach of fiduciary responsibility. So are they covered in the case of a COVID? Potentially, yes. But what happens is, in the D&O policies, there is a standard exclusion in all D&O policies, and that's a bodily injury exclusion. So D&O is never going to cover the board or the association in the event someone is hurt or sick, because that's covered under your general liability policy. So in the case that in the case that the association decides to keep the pool closed, okay, or the amenity closed, and an owner brings a suit against them for keeping it closed because they're losing out financially, that would probably be triggered by the D&O coverage. But let's say the association decides to open the amenity and someone gets sick, claims they're sick because they opened it. Well, the D&O policy is probably going to come into play and say, hey, we're going to exclude that because it's bodily injury. And that goes to the general liability policy. And this is where it becomes fuzzy, because we don't know, depending on what the claim is, if it fits into one of the exclusions. Most policies do not have a communicable disease exclusion. So bodily injury would probably be picked up by the insurance carrier unless you have some type of communicable disease exclusion or a virus exclusion. That's why I say you really need to talk to your insurance agent and understand how that policy works and what exclusions you do or don't have in your policy. Second, another confusing part about it is most general liability policies have a general pollutant exclusion. There's a pollution exclusion that's standard in the general liability form. We kind of haven't gotten much guidance or definitively on if the insurance companies would try to go to this exclusion in the event of a bodily injury arising out of COVID, because the definition of different policies differ in what they define as a pollutant. So you really need to look in your policy language there. So I think the broad statement that people are hearing out there that your insurance doesn't cover it, I don't think is completely accurate, nor do I think the statement that your insurance totally covers it is accurate. It's on a case-by-case basis, and you really need to look at your insurance policy. And so make sure you're in contact with your insurance agent on that. One question that came up about this is, what if I do have an exclusion? What if I do have this exclusion on the policy? What do I do? And someone brought up, I think, David, you did, about legal defense gap coverage. There's a product out in there now that provides a legal defense gap coverage. And I think there's some value to that product as long as you really fully understand what that product's doing. Because a lot of people are saying, okay, I'm going to buy this coverage and now I'm protected for this. You're protected only for defense costs. Okay, they're only providing you with defense. So if you're found liable, this policy doesn't provide any payment for the liability. It only provides you an attorney to provide defense, and that is even limited to certain exclusions and terms in the policy. So you really need to be careful. I think when you're talking about risk as well, what we're trying to do with our associations is really measure their risk, okay? Measure their risk and determine, okay, what's at risk here? You know, an association with 18 units and 12 of them aren't in town during the summer and they have a pool is different than a 900 unit association with 10 pools, a skate park, a fitness center, you know, all of that. So you really need to measure your risk when you're talking about how to buy insurance and what insurance to buy. So that's where I wish I could give these folks the answer on whether to open the pool or close the pool or how to do it in a proper way, because I think that's what they're looking for. But from my expertise, I'm not qualified to do that, and I usually pass that on to the attorneys.
Well, that's a good lead-in for Curtis, because he's the guy who does give those answers.
I do.
So, Curtis, I want to do a couple of things with you. First of all, I want you to update us on the latest as far as the governor's orders are concerned. And then there's a couple of questions. And I'll just give you the general categories. There's a question about short-term rentals. What's the current status of the rule on it? And I think that a couple of people by chat have.
Yeah, there's a couple of about rentals on the chats as well.
And then the common area operational issues seems to be coming up, and I'll go through some of the questions that folks asked. But why don't you start with the latest on the governor's orders?
Well, if you've been following these, and they're easily available on the state's website. You can find all the governor's orders in chronological order fairly easily, because I looked for some of them today. In fact, I'm looking at the one on vacation rentals has a reference to the first order that not the first one but it was the first one of declaring the actual state of emergency was March the 9th, which is only 9 weeks ago. It seems like 9 years ago as we've been dealing with this. But that's how quickly this has all evolved. And I was on a FLA webinar yesterday, and we all said, this is unique. This has never happened to us in the context of running our communities and how we address a major public health crisis that affects not only the residents, but how we operate the properties that as David is a manager and Diane is the president of our association, how we interact with one another. But so the governor's orders are quite broad ranging, and the one for vacation rentals, I'll talk about that quickly. That was very specific, and it only dealt with two types of properties. One is a vacation rental property as defined by section 509, 242, 1C, or a transient public lodging establishment as defined by section 509.013.4A. So unless your property falls within one of those two definitions, you weren't subject to this short-term rental restriction. And so you need to, and there's several about rental zone, Minnesota Key, or things of that nature. You need to, for those communities like that, you need to know whether or not your units are subject to those registrations or not. Some communities are, and some are not. So it's very important that you know how your community is classified. Someone asked, what is the penalty for violating the order? Well, they can be pretty drastic, and these remain in effect. They've just been extended, by the way. They revoke your rental license, which means they put you out of business effectively. Or if you violate the advertising or other means of solicitation, it's a second-degree misdemeanor. So those are pretty straightforward answers as to what the penalties are. One thing that the governor has done in the context of the evolving executive orders is that a week or so ago, he issued Executive Order 2112, which is what's called the Phase 1 Reopening Plan. That one has a specific Section 3D that says the prohibition on vacation rentals in Order 2087 that I was just quoting from remains in effect. So that was Order 2112. Well, Executive Order 20-123, which was only issued last week, says counties on a county-by-county basis can submit a plan to the division DVPR for how to reopen vacation rentals in that specific county. I looked this morning on that website. There are only about 7 or 8 counties. They're all up in the Panhandle, but copies of their plans are there. Projected plans are there. I saw that Sarasota County is going to be submitting a plan. I suspect Manatee County is going to be doing the same. So until that plan for the county is accepted by DVPR, that order is going to remain in effect. So if you are a community that has units that are subject to those permitting requirements or licensing requirements, you're subject to the order until your respective county lifts those orders. There have been several questions about operations, common area operations. Diane spent a good bit of time talking about it. David talked about it from the standpoint of a high-rise condominium. Diane's units are more low-rise, diverse buildings. I represent associations that have the multi-million-dollar amenity center that everybody's so popular to build these days, with outdoor tennis courts, outdoor swimming pools, indoor gyms, card rooms, billiard tables, everything. Someone says you'd like to hear a specific question on our answers on how to open facilities like the gym. Well, David spent 5 or 10, a good bit of his time saying what his community is doing. Diane did the same. I know that other communities that I work with, they got them locked up. They're not even beginning to think about that. Because if you look at what's required under the governor's orders about opening gyms, they're supposed to swab those things down with every piece of equipment, swab it down after every use. I got a haircut this morning for the first time in 2 months. As I walked in, a guy was finishing. the fella cutting my hair took out a 70% alcohol swab, wiped down the whole chair. So if you want to reopen your gym, you'd better have swabs like that by every machine, and you better have your members ready to do the janitorial work, or be able to afford a janitorial service to stand in the gym and swab it down. And I don't think anybody wants to have a special assessment for, you know, running the gym. I'd be darn surprised if that was, if David would go to his board and say, you know, fellas, if we want to really take care of that gym, let's get ABC Janitorial to have somebody there, you know, 12 hours a day. It's only going to cost us $400 a day, but we can swing it. That would go over like a lead balloon.
Well, Curtis, what if a group said, we're not doing any cleaning that's out of the ordinary in our gym. We're going to put a big sign on the front that said, you know, we clean this gym once a day at the end of the day. We're not enforcing any social distancing rules. We're not wiping anything down. And if you still want to use the facility, you do it at your own risk. Has any group taken that position?
Not to the extent that they're not enforcing social distancing. Everybody that I know of who's opened their swimming pools have done along the lines of what you said. They've removed all the pool furniture. They've said, we're not wiping it down. You have to, they're even asking for releases and waivers, which I don't know that they're, how enforceable they're going to be. We'll find out in a few years. But they give you a record, you know, if you think about it, they give you a record of who was in the facility at what time, because they're also requiring use on an appointment basis. And hopefully they will maintain those records until the statute of limitations expires. So that's what's happening. We don't know how courts are going to interpret those releases. You know, on the one hand, if it's a common element, your owner should say, I own part of that. Why should I have to give you, association, a release to use something that I own? And right. The converse is, this is a community and we all have a community interest. And this is what we as a board who runs the community, who was elected to run the community, has chosen to do in the interest of the benefit of the entire community. Whether that's right or wrong, we'll find out in a few years.
Well, Diane, our board took the position that if Wayne and the county decide to open county pools and then presumably have some sort of a protocol for a county operated pool, if our board follows the exact protocol that the county did, do you think that's a type of policy that will probably keep that association out of trouble? Knowing that, you know, all pools are not created equal. Would you agree with that, Curtis?
Yeah, some of our communities are doing that. And they are waiting patiently until the governments open their own pools. One of the questions was, says, just notified by our attorney that Governor DeSantis removed the statement from the executive order, not identifying which one, that allows communities to institute tighter restrictions. And they say, we worry that they want to keep a tight restriction. They say, we're worried that this will increase complaints. I'm not sure what provision that might have been, but I think if there was any reference to communities in the executive orders, it meant municipal governments. I don't think the orders were trying to regulate what's happening on private property, which is what the associations are and maintain and what they have jurisdiction over. They're not telling Costco that you can't have your members all wear masks or not be admitted, which is exactly what Costco is doing as a business decision. And so I don't think that's where the executive order is attempting to do. Because I don't think government can get down in our, you know, they're pretty careful about not trying to over-regulate community associations because they recognize that they're a form of local private government effectively. And so that's how they ought to be viewed. certainly how we're viewing them.
Yeah, there's been a question, and it goes back to liability, about what really is the extent of the risk, and I think it's been raised in other seminars like this, that a threshold question is, will somebody who gets the virus ever be able to pinpoint exactly where they picked it up, which is probably the ultimate reason why cases against associations, based upon the theory that somebody got the virus, they believe it was because they were at your property, and a failure to meet some protocol, that's going to be very difficult for them to prove that. So I think that's going to be a threshold defense that you're going to define in every one of these cases. That, how could you prove that we were actually the ones to do it? The cases that are going to be more problematic for the association are where, frankly, it's an employee of the association who with a group that has had very lax protocol, and they're allowing people to get in their vicinity, or their job requirement allows it. And you've seen a couple of cases where there's been cases brought against retail stores by an employee who said, "You didn't protect me against the onslaught of the public." I think there's some danger with those. But in the end, associations can get sued from either side. They can get sued for not having proper protocol, and they can get sued for being too strict, for an owner who wants to make use of the common elements and says, you don't have the authority to restrict it because I have the right under the documents to use the common elements. So there's risk. There's risk all around. I think that the question was raised before. It's a very interesting question. The more stringent our protocols, are we setting ourselves up in case those protocols aren't met? Are we giving the plaintiff a better case? So if you have a protocol that says we're removing all pull furniture, and 2 days later, some owners who decide that they actually want to have pull furniture out there, they get their own and they bring it out there. And they leave it out there, and then the manager doesn't remove it. Then somebody's using that pull furniture the next day. Did the mandate that there be no pull furniture then set up a case? In fact, if you have lax enforcement, or Curtis, what you said with, if you have a very specific protocol as far as wiping out equipment, and the maintenance guy gets called up to take care of a plumbing leak on the 5th floor, and he's gone for 2 hours. And somebody happens to walk in to the gym at that point in time, it hasn't been wiped down from the last visitor, and they say, that's where I got it. So does anyone want to comment on that type of concern?
Well, we addressed that, or the board addressed that last night. Right. And that offer was made as a possible solution to have a full-time member of staff in the fitness center wiping down and severely restrict the hours, only open it something like 8 to 5 a day and have no evening. And that was shot down pretty quickly. And that was when the comment was made about people have to assess their own level of acceptable risk. And I think it's already been said, if you're prepared to go and work in there and do that, then that's your risk. I think the next step of that is having done that, and then you travel through, in my case, the common areas without a mask on, and then you're spreading whatever you're likely to have, hopefully nothing, picked up during your workout. So it's not just the one person involved, unfortunately, and I'll hand off to Wayne if this is a correct statement. It's the potential to spread what you've picked up and gathered while you've been in the fitness room, and then you travel throughout the building. That was one of the concerns raised yesterday. And that's why I think when it was finally put to bed of what we're going to do, it would be very staged, one person at a time, and then 2 people at a time, and then 3 people at a time, but over a period, and there's no dates attached to this yet. They're still waiting to take guidance from the county and from the CDC about the advisability of when. But those were concerns raised last night.
How are you going to enforce that?
That's the problem.
Are you going to have
Exactly
somebody
the problem.
outside of the gym who's watching one
Nope.
carrying?
Nope, that was stated as well. Thank you, Alan. That was stated as well, because you can't really enforce it. You know, you don't want to have someone stood out there. That's their job to know, Alan, you can't go in. Kochis is still in there. You can't have someone doing that. It's not financially viable. So that then comes down to self-policing. Some people will do it to the minute, and other people will just flout it completely. So, and I think that's where the comment came out that you can only do so much. And the more you do, are you accruing more liability for the association for being that controlling? And then as this has been going on, I've actually written the question for both the attorneys. What authority does the board association have to enforce any of that? So there may be suggestions, and that's the sort of thing I'd like to get from you two. Does the board have authority to make that kind of blanket rule? And I think Diane's going through the same thing. They're trying to do it and getting so much pushback, it's becoming uncomfortable. At what point do you say, okay, enough already? It's up to you. You're grown adults. You go and do what you want to do.
I certainly think the legislature can pass legislation granting immunity. You know, they in the medical malpractice area, they have strictly limited the type of liability that physicians in Florida could have. So they can, there is precedent for intruding legislatively on you know, rights to sue and so forth. I have greater doubt whether that could be done by executive action by the governor, because the argument would be made it is an intrusion into the legislative. Curtis, you have a different thought on that?
No, I would tend to agree with you, but now I'm seeing the comment I made earlier about the order that allows more restrictions on communities. It was not to one of the governor's orders. It was to the executive order issued by DVPR, which says that the emergency power provisions in each of the statutes are applicable to this medical emergency, even though, quite frankly, they are written in terms of damage to property. It was a somewhat strained interpretation, and with respect to 720 associations, apparently totally without authority, but everybody went along with it. And so now, and Talise McKay, one of the other board members, is on the call with us. I haven't read that opinion, but while we've been, she asked whether it expires June 1st or whether this may be until the state of emergency on July 3rd. Well, while we've been talking, I've gotten an email from Travis Moore, FLAW's, CAI FLAW's lobbyists who frankly helped draft that executive order, saying it expires June the 1st. So I think whatever, and I'll read the order, but I haven't seen it yet, but I think it's going to expire June the 1st, which is right around the corner. So one thing FLAW is doing, though, if we have an emergency session this year, which is likely, we're going to propose some language that would amend those emergency power clauses to deal with medical emergencies or declare medical emergencies to expand those powers. But so all this discussion about that a lot of these actions have been taken under the aegis of emergency powers. You know, it's either going to go away June 1st or July 3rd. And if the DVPR order or opinion or whatever they've written talks about order 2020-04 expiring June 1st, that's the day it's going to expire. So that's where we are.
All right, Wayne, let me turn to you, because while we were going, you have more information about the plan approved by the county commission just this morning regarding vacation rentals. And again, as Curtis indicated, this then gets sent up to the I guess the governor's office for approval. Curtis?
Yes, DVPR is approving them, and apparently they're on a fast track because they could only start submitting them last week, and 8 or 10 of them are already approved. So they're not wasting any time getting it done.
All right, so Wayne, why don't you tell us about the county's proposed plan for vacation rentals?
Sure. So the Sarasota County, and I don't know if the person on Minnesota Key is in Sarasota or Charlotte County. So obviously you'd have to monitor Charlotte County's commission if you're in Charlotte side of Minnesota Key. But in Sarasota, they have issued a plan up to the state that is requesting that vacation rentals reopen in Sarasota County on May 22nd. It would allow reservations from individuals from any U.S. states that has a case rate less of 700 cases per 100,000 residents as of May 18th. It would not allow any international travelers at this time. And for the next 45 days, it would ban any travelers from any locations that the governor had put in any previous executive order. But beyond that, a lot of it is around CDC guidelines for cleaning, sanitation, appropriate signage to the guest, and the like. So, we're hoping, like Curtis said, that they'll approve that, they're approving those rapidly. So the board is hoping that by Friday of this week, the state will respond. Obviously, they're not any obligation to respond by Friday. So, we don't know if that will happen in Sarasota County on May 22nd, but we're trying to get it, the county's trying to get it into review.
It's interesting that the Florida Supreme Court decided to give the Florida bar exam in July. It's going to be at 2 large convention centers in Florida. And one of the requirements is that if any out-of-state people, and they don't distinguish between the states, wants to take the Florida bar exam in July, they have to quarantine for 2 weeks and attest to the fact that they have quarantined for 2 weeks. One of the things they don't make clear, I guess that means a quarantine after they arrive in Florida, because I can imagine somebody quarantining at home in, New York, and then they go to, JFK to fly to Tampa for their test. That may not be what the Florida Supreme Court had in mind. Somebody asked, and we kind of covered this, if you follow the county requirements, does that give you some relief on protocol? Again, as a trial lawyer, if I was a plaintiff's lawyer and I knew, for instance, that Sarasota County had adopted a certain protocol, opened its polls and adopted a certain protocol, and my association followed that, I think that would be a pretty strong defense that you follow the governmental entity's lead. Not airtight, but I think that would be a good defense. Somebody gave a very specific question about testing and whether it's okay for them to go back to work. That's probably not.
They should call their doctor.
That's
Follow
not
their medical advice.
Yeah, that's not a specific.
We're not doctors, unlike some people who will give medical advice.
that anyone.
While we were chatting, I did look at that order from DEPR, and it's pretty explicit that all that's going to expire on June 1st, unless you're a harbor pilot, and that's going to be continued. But we're not harbor pilots, so our executive powers are going to the ones applicable to HOAs and condos and co-ops are going to expire June 1st.
All right, let's do this. We have 10 minutes, and I want to go around the panel and give everybody an opportunity to give a final expression, and maybe just telling people to stay safe. So, David, why don't you go ahead and give us some final words of encouragement?
Well, I think that what you're saying is right. We do need to stay safe. We need to take care of ourselves. And I think the biggest worry I've had as a manager is trying to make sure I'm doing everything I can to keep everybody in the building, staff and residents, owners, safe. I believe we have, and we will continue to do that. And I think the biggest thing I've got out of the last 2 or 3 days of meetings and webinars and everything is you have to accept, or you have to assess your own level of acceptable risk. So as you said, you've got people on both sides of the fence. Some people they're full PPE all the time, face mask, goggles, everything. Other people don't care. So you have to work and look after yourself first. Then you can start looking after other people. We'll get through this. We'll get through this. We'll be okay.
Good. Diane, any parting words?
I think, like David said, I think you have to assess your community and whether you can, you have confidence that they will follow the protocols. I think, ultimately you just have to close things back down if it gets out of control. But I think you have to trust in them and just move forward. If it, we're trying to do this as minimally as possible. We're taking as much away as we can to open the pool. But in the end, it's an individual decision whether you want to use the pool or not, and whether you're going to follow the rules or not. So I don't know what we can do beyond that.
Okay, Cindi, any parting words?
Yes, I'm being here on behalf of the business partners. Just if you have a need for any reason, if you're a board member, manager, or you need some home services, just be honest with that person who answers the phone and says, yes, I have this issue, whether it's plumbing, roofing, tile repair. Say, just be honest and say, I'm having issues with this. Can you do this? 99% of the chance they're going to do that. So just be honest with them. So if you have something, we're all still out here working for you. So if there's anything that anyone needs, if you can postpone it and it would make you feel better, that's great. But we are all here. Just be honest with the person and we'll make it happen.
I think important, Cindi, is for people to communicate to you what their protocols are. Right? Yeah. We had an AC guy who just strolled into our office yesterday to do a repair, no protection or whatever, and we chased him out of our office. Now, his company should have known to call and say, before I send my guy up, do you have protocols? So
that's what our CSRs do. They ask, okay, so if it's a sales call or a repair call, we can do it on Zoom, we can do it on Facebook, I can meet you, I don't have to go in. All sorts of information is already gotten before our salesperson gets there.
Okay, Wayne, a quick final comment. And
Well,
by the way, happy birthday, because we all in November.
Thank you. No, I think I would just have to close with our public health message, to keep yourself safe, maintain distance where you can, avoid crowds, wear PPE, good hygiene. And if you have any interest in having a test, you can call our local hotline at 941-861-2883. And they will be able to advise you where you could get tested.
Do you get the results, Wayne?
Well, that's a very interesting thing. So each site is actually managed and operated by different individuals or different entities. Even though they may be state agencies, they don't all operate the same. So each have different requirements, different laboratories that they use, different tests that they use. So again, I would encourage you to call the 861-2883. They can go over those with you and you can make a personal decision about which one you want to go to. I will say that when they opened up the large site at UTC, that was done through Florida Emergency Management at a state level. It didn't appear that they had a process in place to rapidly notify people. And they took the approach that they would work to notify only the positive people. And the positivity rate at that site has been less than 2%. So a vast majority of people haven't heard anything because it wasn't their priority. My understanding is that's getting better. The local sites here that are run by DOH, we've been generally getting site results back within 48 hours. And our local staff will call you whether you're positive or negative.
Good. Okay, Tommy, real quick.
Yeah, actually, I have three quick things. First of all is talk to your agent and know your policy. One size doesn't fit all, so it's going to depend on the specifics of your policy. You really need to get an understanding of that. Once you have an understanding of that, you can manage your risk better. So if you know you have a communicable disease exclusion or one of these wacky exclusions on the policy, you could then take it and say, do we want to open these amenities or how we want to go about doing it? So manage your risk. And when I'm talking about manage your risk as well, make sure you document everything. So in the case something does come up down the road in the form of a claim or someone's claiming liability, any documentation of the procedures you have in place is going to be helpful, possibly in understanding what the association did or didn't do. And finally, with everything, anytime you get a report of whether it's a claim or demand, make sure you notify your agent and insurance company, because the one thing the insurance companies love to do, or not love to do, but the first thing they look at is make sure that that claim or that incident was reported in a timely manner.
No,
So
they
we want
love
to make
to.
sure we want to make sure that we get that into the insurance company so they can't come back and say, hey, you didn't tell me about it. So,
Okay, Curtis, parting thoughts, quick?
Well, I would say just because DBPR has lifted that order dealing with the executive powers interpretation, let's not panic. The governor's orders still say adhere to CDC guidelines during all this reopening. I think that's sound practice. And someone else has asked, how do they know if their county plan has been approved because they're in Charlotte County? Go to the DBPR website and you'll see it. They're keeping those up to date. So don't panic. We'll all get through this, and this too shall pass.
All right, Karin, I didn't know if you had parting words or wanted to tell us about the next event or whatever you.
Well, I just want to expand on a couple of things. Curtis, the DBPR website is myfloridalicense.com for those people who don't know what the DBPR is. And I just want to say that from an association perspective, the board and I are going to monitor. We have been monitoring all of this. We're not going to put any of our members' health in jeopardy. And I've got 3 board members on this call as a panel. We don't care if other people are out there having luncheons and doing that. We're going to do what we believe is right. And we're going to continue these Zoom webinars, which have been, you guys did a fabulous job today. Got several comments on my phone that it's a really great webinar, great information. So we're just going to keep doing what we're doing until things change and the board feels that it's safe for us to start meeting in person again. And with that being said, I want to thank everyone. I want to thank the panel. You guys did a fabulous job. And I want to thank everyone for joining.
Thank you, Alan.
Thank you.
Thank you. Take care, everybody.
Stay healthy.
Take care.
Bye-bye.
Bye.
Bye.